Hi, I'm Dr. Heathcote Wright and welcome to Melbourne Comprehensive Eye Surgeons. Cataract is an opacification or clouding of the lens. The front surface of your eye is made up of the clear cornea. Behind this you can see your iris, the coloured part of your eye, that surrounds your pupil. Behind the pupil is the lens. Light passes through the pupil and is focused by the lens so that it lands on the retina, where it forms a clear image. This is how we see. As we age, the lens develops a yellowish discoloration and can become cloudy. When it starts to blur vision, it becomes a cataract. The cataract blurs the light entering our eye and the retina can no longer detect a clear image. Cataract is the most common pathological cause of decreased vision in Australia. Before the operation, you'll be given drops to numb your eye and dilate the pupil. You'll also be given a twilight anaesthetic that will relax you during the procedure. You should not experience any discomfort. In fact, many people have little or no memory of the experience. We're now going to run through the basic steps of cataract surgery. We start the operation by making 2 small incisions in the cornea at the front of the eye. Then we fill the eye with a clear jelly to stabilise it. The old cataract is surrounded by a thin skin or capsule. We will eventually use this capsule to hold the artificial lens in place. To access the cataract itself, we create a circular opening in the front part of the capsule. We then inject some fluid under the capsule to separate it from the cataract. Once the cataract is separated from the capsule, we insert a phacoemulsification device. This is about the thickness of a grain of rice and can be thought of as a cross between a tiny jackhammer and a vacuum cleaner. The jackhammer is powered by ultrasound and breaks the hard cataract into tiny pieces. These tiny pieces are then safely sucked out of the eye by the vacuum cleaner. To ensure we protect the capsule that will ultimately hold your artificial lens in place, we need to bring the cataract to the front of the eye where it is safe to use the ultrasound to break it up. This is achieved by dividing it into quadrants. The large hard cataract is cracked in half and then each half is cracked again, leaving quarters. We lift the quadrants away from the capsule into the front part of the eye, where it is then safe to use pulses of ultrasound to break each quadrant into tiny fragments that can then be sucked out of the eye using the vacuum. A small amount of cataract, called cortex, is left stuck to the capsule like a mandarin is stuck to its peel. To remove this last part of the cataract, we insert a second instrument and gently peel the final part of the cataract from the capsule. Once the last piece of cataract is removed, we are left with a clear capsule that we fill with a kind of jelly. This makes room for the artificial lens to be inserted. The final step of surgery is to insert your specific artificial lens. Each lens comes folded, allowing us to insert it through the very small incision we've already made. Once inside the eye, we carefully position the lens within the capsule. The lens then unfolds and becomes secure within your eye. To complete your surgery, we inject antibiotics and seal the wounds without the use of sutures. Your cataract has now been replaced with an artificial lens that is once again able to focus a sharp and clear image onto the retina. Thank you for taking the time to watch this short presentation, and I look forward to meeting you soon to see if we can help improve your vision.